Good evening. We're so glad to have you tonight as we talk and learn and grow in terms of our understanding of colorectal cancer. We are so excited that you've taken the time, and we don't take it lightly, that you want to learn and grow and know about colon cancer. This is a preventable illness. This is a preventable challenge that we have, and thus we want to attack it. And so tonight we have special guest panelists that are here for you, and they're here to answer any questions that you have. So once again, thank you for joining us. I'd like to introduce them, if I may, at this time. We have Dr. Hackworth, who is a board-certified and fellowship-trained gastroenterologist, and he has over 10 years of experience and actually builds boats. So if you have any questions about building boats, feel free to ask him, not us. We also have Ms. Bethany Edge. She is a master's degree candidate in nutrition and education and is a teacher. And so she will educate us on the nutritious things to do and those not to do as it pertains to preventing colorectal cancer. Thank you so much, Mrs. Edge, for being here on this evening. And lastly, we have Dr. Joshi, who's new to Riverside. She's also a board-certified gastroenterologist, and she's been in practice for more than 10 years as well. She actually hang glides and skydives, so if you have any questions about that, direct those to her, not me. So again, thank you, Dr. Joshi, for being here this afternoon. You know, when we talk about today as well, we have to realize and not forget that green is what most people are wearing today because we celebrate St. Patrick's Day. And I learned some facts about St. Patrick. I learned that his real name was not St. Patrick. It was actually another name that I'm not going to pronounce right now. However, St. Patrick is as we know him. And we don't know if he had colon cancer, but we do know that they didn't have colorectal cancer screening. And so they do today. And so we are just excited about using that and learning about that on this special day in which we commemorate St. Patrick. When we talk about colon cancer screening, it has changed in the last 3 or 4 years. In 2018, we actually changed when and how people should be screened. The ages have changed, the methods have changed, but screening still is vital. And so March is the month that Riverside and the world and the nation has chosen to look more closely at colorectal cancer so that we can prevent this illness and so that people can recognize it early, look for signs and symptoms, know the risk factors that may be in their families, and eradicate it, because we are in that business of eradicating illness. The first thing we'd like to do is talk about a testimonial. Sometimes when we have people who've gone through things in our lives, it really impacts us on a different level than someone maybe we aren't familiar with. We'd like to introduce you to Mrs. Barbara Klein. She is a wonderful young lady who has a wonderfully blossoming family and a really wonderful story that I think we all can glean from. So please listen to this, and we will come back after we share her story with you.
My name is Barbara Klein. I live in Williamsburg for 24 years. I'm a retired school bus driver after 13 years in Williamsburg, James City County with the best children in town. I have 4 children, 4 girls, 4 very active daughters ranging in age from 38 to 28. They're all 3 years apart. A pastor's wife at the same church for 24 years. A Mimi to 5 of the most amazing grandchildren, and soon to be 2 more, another set of twins that are due in June, so that makes 7, and the joys of my life. I got my first colonoscopy at age 60, which is really late in life, and I know that, and I don't recommend that. With my busy family, I had all the excuses for all the wrong reasons. I met a friend at a Jeep event in Nags Head, the Outer Banks. She was diagnosed in 2016, and it was now 2018, and she was diagnosed right away with stage 4 colon cancer. After hearing her story and spending time with her, I was compelled, I've got to get this colonoscopy. So I made an appointment with my primary care physician, Dr. Ainsley, and about that time they were showing the Cologuard commercials. So I thought, I can do that. Got the Cologuard test in the mail, and I thought, this is great, I'm gonna do this, it's gonna be so easy. Read all the instructions, and it was easy. Dr. Ainsley's office called me right away and said that it came back, it was a problem, and that they needed to get me in as soon as possible to see Dr. Converse. They reassured me that this doesn't necessarily mean that it could be cancer, it just means that there's something that showed up that they need to do a real colonoscopy procedure. The prep was not that bad at all. I guess they've perfected that over the years, you know. I used to hear horror stories, but not so bad at all. Dr. Converse called me and told me I did have cancer and it would require surgery. At that point, we didn't know if I would have to have chemo or radiation, but I did not. So I have the most amazing team of doctors, from Dr. Ainsley to Dr. Converse to Dr. Billings to Dr. Miller. They are just such a great team, and you know, there's so much that can be detected just by being aware and having your test and your appointments. Just don't let life get in the way and keep you so busy, being busy with the things that you enjoy, that you forget to take care of your body and get your screenings. It's not just for yourself and your health, it's for your family's sake. You want to live to see your grandchildren. You know, it's just so much can be done with early screening that they find out and catch it right away and move on, and then be an inspiration to others.
Wow. You know, Mrs. Klein's story was so relatable. I'm sure we have friends, and unless we enter discussions that maybe we don't want to, we would be like her. But we are thankful that she extended herself to her friend, and her friend was going through stage 4 colon cancer, and then she realized, you know, I have to do better for me. And now she's able to just experience her coming grandchildren life with her church, but also she did better for herself. And so we realize with colon cancer today that the ages are a lot younger in which people are diagnosed. One of the reasons that Riverside wanted to come to you tonight, and we come to you with experts, is to realize that age matters. And if you can be aware, maybe we can change the trajectory of your life and eradicate colon cancer. So when we talk about ages, I'd like to have Dr. Hackworth at this point give us more information about that. Thank you, Dr. Hackworth. Take it away.
Thank you, Dr. Williams. So colon cancer, unfortunately, is one of the most common cancers in the United States. About 1 out of 20 people will develop colon cancer during their lifetimes, so about 5%. And it's actually the second leading cause of cancer death in the United States. Importantly, though, colon cancer is treatable. As we saw with the patient who just spoke, if it's caught early, colon cancer can be cured. And in fact, there's over 1 million people in the United States today who have survived colon cancer. Unfortunately, as you can see in this illustration, some counties in the United States have a much higher rate of colon cancer deaths, and we call this the colon cancer belt. We don't know why these areas have a higher rate of colon cancer, but unfortunately, Hampton Roads is one of those areas where there's a significantly higher rate of colon cancer death. So more than other people in the United States, we're at particular risk of colon cancer. Now, traditionally, colon cancer has been thought of as an old person's disease. We think of turning 50 and getting our colonoscopies. And it's true that most colon cancers do develop after the age of 50. But people, even in their teens, are getting and dying from colon cancer. About 15 years ago, it became evident that there was a clear and disturbing trend. 40 years ago, about 5% of colon cancer patients were under the age of 50. But as recently as 2010, about 10% of colon cancer victims are under the age of 50. And this is probably partly due to improved screening and detection after the age of 50. But we also see a very real and striking increase in the rate of death from colon cancer in people who are young. So one response to this change in the incidence of colon cancer in the young has been to reduce the recommended age of colonoscopy from age 50 down to age 45. And so now most societies and most insurances recommend starting colon cancer screening at age 45 rather than 50. Colonoscopy is important because it provides very powerful protection against the development of colon cancer. And it does this by looking for small little growths called polyps. Many polyps over time will turn into cancer, and so by removing those polyps, we prevent the development of cancer. And colonoscopy is the only test that can detect and remove those polyps before they become cancer, whereas other tests often only pick up the problem once it's developed into a cancer. In addition to getting your colonoscopy, we'll talk later about some risk factors that you can modify, like diet and exercise, that can reduce your risk of colon cancer. But another extremely important thing that you can do is to ask your family about family history of colon cancer. Having just one relative with colon cancer can triple your risk of developing colon cancer. And in some cases, you may need to start being screened for cancer as early as age 15. Many families don't like to talk about their medical history. They don't want to talk about the uncle who had cancer or what they've been going through. But it's so extremely important to know that history because it has such a powerful influence on you as the patient. Now, most people with colon cancer have no family history, and this applies to the young as well. Only a small percentage of very young and young people who develop colon cancer have a family history, but those that do need to be screened and much more aggressively, so it's really important to know that history. Other conditions too, like ulcerative colitis, can significantly increase your risk of colon cancer, and so it's important to be aware of how that may impact your risk. Now, I've had many patients come to me who unfortunately were diagnosed with cancer, and they say, oh, I never had a colonoscopy, I never saw a doctor because I felt fine. And unfortunately, many patients with colon cancer never have any symptoms. But colon cancer does cause symptoms for many people, and this can include a lot of different things. Constipation, diarrhea, consistent change in the size of your stool, abdominal pain, weight loss, and especially blood in the stool can be indications that something's wrong in your body. Anemia is a routine, it will show up on routine blood work. And unfortunately, anemia is very common in young women because of menstrual cycles causing blood loss. And so that anemia often gets overlooked, but anemia can be another very important sign that something's wrong. So it's important to know your body, to inspect your stool even when you're young, and to know what's normal for you and what's not. But at the same time, remember, if you're older and if you have risk factors, or if you're of age, it's very important to get that screening test even if you feel completely fine. If you are concerned about symptoms that you're having, talk to your doctor and be persistent. Doctors aren't used to seeing colon cancer in young and very young people. And so it's really important to push for investigation if you feel like something's not right with your body. Be aware of what risk factors you have, and especially that family history. And don't be afraid to get a second opinion if you feel like your doctor's not listening to you. I'm going to hand things back to Dr. Williams now, and she's going to discuss some of the powerful ways that our lifestyle choices can affect our risk for colon cancer.
Thank you so much, Dr. Hackworth. That's vital and really important information. And as you mentioned, there are 5 key preventative ways in which we can look at preventing our risk for having colon cancer. I'd like to focus on one of those, but I'll tell you all 5 of those, and then I'll have Mrs. Edge continue with the other ones. The first one is stopping smoking cigarettes. And I will load into that cigars, chewing tobacco, vaping, I would even say marijuana use. And so I'm going to focus on that and then move on a little bit. Limiting your alcohol consumption, even on tonight with St. Patrick's Day. Exercising, maintaining a healthy diet, and one that we are really going to focus on with Dr. Joshi is screening. So when we talk about smoking cigarettes, we realize that cigarette smoking impacts all areas of cancer diagnoses. In most all of the cancers, we'll find out that a risk factor is smoking. And it does matter how long one has smoked, but just the mere fact that you smoked at all can impact your chance of having cancers. Tonight we're focusing on colorectal cancer, so I will deal with that. We think that colon cancer, in terms of smoking, has to deal with the colon being inflamed. And so cigarette smoke, the toxins that are in that smoke inflame the colon. And that actually may help the cells mutate to then become cancerous. So we know more on a research perspective, but for our purposes, we feel that smoking cigarettes will change the dynamics of cells in the colon, and thus put you at increased risk for cancer. We know that in women, there is a 19% increased chance in a woman that smokes who may have cancer. Likewise, in men, there's an 8% increased risk of colon cancer in one that smokes cigarettes. So those are things that have been proven in terms of research. When we look at that first-degree relative that Dr. Hackworth mentioned, the person that smokes cigarette has in almost the same risk of having colon cancer as someone that has a first-degree relative. So just by eliminating cigarette smoking, you can decrease your risk of having colon cancer. The last thing I wanted to mention is that even if you stop smoking cigarettes, which we want, there's still a slight increased risk of having colon cancer. So I encourage those of you who smoke cigarettes or even thinking about it to stop smoking cigarettes, not just for saving money and dental services and less perfumes that you're buying or colognes, but think about colon cancer on this month. And think about the fact that you save your life, and thus you help be here longer to experience more of it. At this time, I'd like to have Mrs. Edge tell us more about the other risk factors that we can prevent in terms of colon cancer, and some things nutritiously. You can eat some green things tonight for St. Patrick's Day. Maybe that'll help improve your risk to not get colon cancer. So I'll have her continue to educate us on the preventive factors for colon cancer. Mrs. Edge.
Thank you so much. Well, I know that many of us here have had our lives touched by cancer, and so we know what a difficult journey it can be, and it's really important that we take control of our health now and do things that will help reduce our risk. So that's my job as a dietitian, is to help people take control of their lifestyle and make those changes. I'm going to let you in on a little tip. There's no magic diet, magic food that any of us can eat that's going to just magically reduce our risk of colon cancer. It really does go back to the basics, things that you've probably heard before and you've been learning your whole life. The first is eating a whole foods diet, high in fruits, vegetables, whole grains, lean meats, and healthy fats. A good goal is to get 5 servings of fruits and vegetables each day, and to make at least half of your grains whole grains. Additionally, reducing processed foods, including processed meats like deli meats, hot dogs, and even reducing red meat can reduce the risk for colon cancer. Some of the favorites in our house, we love cucumbers and broccoli. It's a really easy one. You can buy frozen broccoli and microwave it and just add it with any meal that you're eating. We also love whole wheat tortillas. These are really popular foods to help people get started as they're transitioning to a healthy lifestyle. Many individuals also have questions about the link between eating sugar and cancer and wonder if sugar can feed cancer. The answer to that is not directly. Foods high in added sugar are generally low in vitamins and minerals and fiber, which helps support our health. And eating high amounts of added sugar can increase our risk of developing high blood sugar or hyperglycemia. There may be some link between hyperglycemia and the development of cancer. So it's a good idea to limit our sugar. Now, cutting out sugar is not as simple as just saying we're going to stick away from it. We need to know what we're going to replace those sugary foods with in our lives. And I recommend reaching for snacks that include protein, healthy fats, and fiber. Nuts are a great way to beat those sugar cravings and make sure we're eating foods that are going to keep us at a healthy blood sugar level and reduce our sugar cravings. Additionally, alcohol, as was mentioned, can contribute to our risk to colon cancer. So a good limit is 1 drink a day per women and 2 drinks per day for men. Men are especially at risk. Seems to be a stronger link between alcohol consumption and colon cancer for men. So really keep an eye on it. Serving sizes for alcohol are 1.5 ounces of liquor, 5 ounces of wine, or 12 ounces of beer. So yes, even tonight on St. Patrick's Day, make sure you are just mindful of the way that this can impact your health. And finally, exercise. The American Cancer Society does recommend that we all exercise 150 minutes of moderate intensity activity each week or 75 minutes of vigorous intensity activity each week. You can mix and match. And if this seems overwhelming to you, it's okay to start small. You can start by just walking for 30 minutes a day. If that's too much, start with 10, and then the next week do 15, 20, until you're up to 30 and meeting that goal every week. Small changes really can have a big impact on our health, and it's important that we try to be 1% better every day and make these little changes, do what we can, because they can have a big impact and really reduce our risk and keep us strong and healthy and living wonderful, long lives. Thank you so much.
Thank you, Mrs. Edge. That was really important information. You know, when we talk about switching gears a little bit to looking at how we in the medical practice can help eradicate colon cancer, we talk about screening. And screening, by definition, is a test or tests that are performed when you don't have symptoms, when you don't have signs of an illness. And so screening is a large role, it plays a large role in eradicating many diseases. Specifically tonight, we're going to talk about colon cancer screening. And the best screening test is the one that gets done. So at this time, we'd like to have Dr. Joshi come and educate us about different screening methods to eradicate colon cancer. Thank you, Dr. Joshi. Want me to talk? Okay. 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 Go back. Okay. At this time, I'd like to talk about screening for colon cancer. When we talk about that definition of the word screening, it's when we run tests, have things performed that a person does not have symptoms, does not have signs. And so we'd like Dr. Joshi at this time to give us more information regarding the screening tests that are available. Dr. Joshi.
Thank you, Dr. Williams. Colorectal cancer screening is very important for 2 main reasons. One, colorectal cancer is the 3rd most common cancer in men and women in the United States today. And 2, it's not only curable, it's actually preventable. As Dr. Hacksworth mentioned, colon cancer rates have been increasing in people under the age of 50, so recent guidelines have changed. Currently, we recommend colorectal cancer screening for everyone starting at the age of 45, and sooner if you have certain risk factors, such as family history of colon cancer or advanced premalignant lesions, personal history of colon polyps, certain medical conditions like ulcerative colitis or Crohn's disease, or if you have genetic syndromes that run in the family, like Lynch syndrome or FAP. The most common two colon cancer screening modalities are stool-based tests and colonoscopy. There are two stool-based tests that can be used. One is the FIT test that's done once a year, and it checks for microscopic blood. And the other is the Cologuard, which checks for microscopic blood as well as markers for DNA mutations. And that's done every 3 years. Both of these tests are very good at detecting colon cancer early. However, they're not very good at detecting precancerous lesions called polyps that will eventually lead to cancer. If these tests are positive, the next step would be the colonoscopy. Colonoscopy is the gold standard for colorectal cancer screening because this is the only test that can prevent colon cancer. Colon cancer starts off as these little abnormal growths in the colon called polyps that grow over time and eventually can turn into cancer. By finding these polyps and removing them, we can prevent colon cancer. Now, the hardest part about doing a colonoscopy is the day before the procedure when you're doing the prep. You'll have to start off by being on a clear liquid diet for the day, and that evening you're going to take a very strong laxative that will make you go to the bathroom a lot. But the cleaner you are, the better look we can get the next day. So it is very important that you follow all of the directions and take the entire prep. Because if the colonoscopy is clear, we're able to identify these polyps and remove them and prevent colon cancer. If there are no polyps found during the colonoscopy, then you wouldn't need another one for 10 years. Now, if there are polyps found, depending on how many, what type, and the size, will determine the next colonoscopy. To summarize, I strongly believe that the colonoscopy is the best colorectal cancer screening modality for most patients. However, if you have any questions or concerns, please discuss it with your provider so you can pick out the best screening modality for you. If you have any questions, I'm happy to answer any questions during the Q&A. Back to you, Dr. Williams.
Thank you so much, Dr. Josie. That was vital information. You know, screening tests are important, and often, as she said, the best screening test is the one that you discuss with your primary care provider to decide what's best for you. I would just add to that and say the best screening test is the one that gets done. Now, let's say you go through a screening test and it is positive and colonoscopy reveals that there unfortunately is cancer. There might be times where you wonder, how do you get around that? How do you get through that? How do you process that? And we're really fortunate tonight to have a board-certified colorectal surgeon who is going to share with us what happens when someone does have a diagnosis of colon cancer and how we process that and go through that. So at this time, I want you to listen to Dr. Billings as he gives us more vital information.
The most important message for colon cancer is that we believe it's almost a preventable illness. If patients are adequately screened by good endoscopists underneath the correct time, we can probably cure the majority of cancers by removing the polyps before they become cancer. And I think that's the big push that we need to have right now. There's been a large increase in colon cancer in what we call younger patients, which would be patients under 50, right? In fact, it's been a large enough increase that we changed the screening recommendations now to 45 from 50. But now that people are starting to become attuned to that risk or that possibility, I think they're starting to screen them more quickly. When they do the colonoscopy and they see a polyp, there are times that they can take that polyp out, and if there's a small focus of cancer in that polyp, but the margins are clear, those patients may not need more surgery. It depends on a couple factors and on the specific cancer. And in each patient's treated individually, we look at those polyps and those cancers individually and try and get a treatment plan that will fit them, so we don't do any unnecessary surgery. And there are patients that we can avoid surgery on and just follow them more closely. Radiation for colon cancer is only used for rectal cancer, and generally we use that before surgery. And the reason that we use it before surgery is it will decrease the size of the tumor, and which will improve our odds of removing it completely, probably improve our odds of being able to put them back together so they don't have a colostomy bag, and it definitely decreases the long-term recurrence rate, so it improves survival. Chemotherapy is generally based in the lymph nodes. When we take out the tumor and the lymph nodes, if the lymph nodes are all negative, we generally do not give chemotherapy. In rare instances we will, but we generally don't. If the lymph nodes are positive, that means that the cancer has gotten through the wall of the colon and is trying to become more systemic, and that's when we would use chemotherapy. The chemotherapy that we use today for colon cancer is very effective, and the side effects are very well tolerated. Our options for treating what would be considered terminal colon cancer or stage 4 colon cancer have expanded, and our survival has expanded as well. Now we treat it almost like a chronic illness. One of the great things at Riverside is that we have a whole team of people working. And so that includes the gastroenterologist, the surgeon, the medical and radiation oncologist, and the radiologist. And I think it's a better way to approach these kinds of cancers because it allows a greater breadth of knowledge. If you have colonoscopies as recommended, so at the recommended times, right? You know, starting at age 45, every 10 years if it's normal, or sooner if they find polyps, then we expect to find polyps that are smaller, and the chances are that if a cancer had developed in a polyp, it'll be earlier. And statistically, it's shown that your chance of dying of colon cancer is less if you have good colonoscopies done by good endoscopists. And at Riverside, our endoscopists are well above the national average for finding polyps, which is a key marker as to their quality.
Throughout this evening, we've received some questions. And so I believe we have a question from Andrea.
Hi, my name's Andrea. I was wondering if you could tell me if one type of colon cancer screening method is better for women than others. Thank you.
Thank you, Andrea, for your question. I believe, Dr. Joshi, you can help us answer that. Next question? Okay, thank you. We also have a question now, I believe, from Sarah. Let's take a look.
Hi, my name is Sarah and I have a question. Are certain races or ethnicities more prone or at a higher risk for developing colon cancer?
Thank you, Sarah. I have the honor to answer that for you. You know, as a brown person, I look at various ways that I can help myself and my community live and be healthier. In terms of colon cancer, yes, is the answer to your question. There are African American people that are at higher risk for colon cancer, and we don't know specifically why that is. We have a lot of different hypotheses, and we have some true facts that we know about, and I'll share those with you now. Part of not getting cancer is finding it and detecting it earlier. And sometimes within the African American community, it is not detected until later because screening is not performed by people. And when you kind of go back to why, often it may be related to the community talking about comfortably about risk and symptoms and signs. It's about putting yourself first, as we learned with the Mrs. Klein story, that often we put our other people ahead. So often in the African American communities, it may be that there is less of a concern about the person and more about the family and jobs and not having time to be screened and not asking the proper questions when they see the physician. So those are things. There is another group of people, Ashkenazi Jews, that also has an increased risk of colon cancer. So as we continue to work and find out ways to level the playing field, we do look at certain groups that tend to have increased risks of colon cancer. When you look at health systems, I applaud Riverside in making this issue and bringing it to the community to engage all of us in this discussion. But often with health systems, we have to look at insurances and doctors, such as myself, providing time to discuss issues with specific populations about colon cancer screening. So as we do better on all ends, hopefully we can in the future not talk about having increased risks within African American populations, Ashkenazi Jews, and we'll eradicate colon cancer. Thank you for that question again, Sarah. At this time, I believe we have a question from Sid.
Hi, my name is Sid. I have a question. How hard is it to prep for a colonoscopy?
Thank you for your question. When we talk about answering this, I think we're going to go to Dr. Hackworth to help us out.
Well, Sid, you may have heard from other people that getting ready for a colonoscopy, what we call the prep, is not fun. And it's true that it used to be quite an ordeal. Many patients have compared the prep to drinking a gallon of seawater. Fortunately, there are many, many options now for prepping other than drinking a gallon of seawater. There's a number of different prescription options which have much less volume and which have an improved taste. There is a tablet-based prep which does require drinking a lot of fluids. In my own practice, I typically use a concoction of Gatorade and Miralax. It has no taste other than the Gatorade, and it's generally very well tolerated. The most important thing, of course, is that the prep does its job and that it cleans out the colon adequately so that the gastroenterologist can have a good look throughout the entire colon and remove polyps. And we've done that not only with the change in the prep itself, but also in the way it's taken. So we split the prep up into two smaller doses, which are taken 2 separate times. And that helps ensure that the colon gets completely cleaned out and that we're able to do a quality exam. But the bottom line is that things are nowhere near as bad as they used to be. There's a lot of different options that you can discuss with your doctor, but for most people, there's preps available that are generally very well tolerated.
Thank you so much, Dr. Hackworth, and thank you, Sid, for asking that question. I'm sure that's on the top of a lot of people's minds. I do apologize earlier for some technical difficulties, so we're going to hear Andrea's question again and have Dr. Joshi answer that for us.
Hi, my name's Andrea. I was wondering if you could tell me if one type of colon cancer screening method is better for women than others. Thank you.
That's a great question, Andrea. As I mentioned before, colorectal cancer is the third most common cancer in women in the United States. 1 in 25 women will develop colorectal cancer in their lifetime. And this is a very scary statistic because this is a preventable cancer with appropriate screening. And I do think that the best screening for colorectal cancer is colonoscopy, because this is the only test that can prevent colon cancer. And that's even more important in women because right-sided colon cancer is much more prevalent in women compared to men. And it has been associated with poorer survival. Now, if these lesions could be caught early during a colonoscopy when they're still in the precancerous stage, we can remove them and prevent these cancers. So I would strongly recommend colonoscopy for most women.
Thank you so much, Dr. Joshi. I appreciate that. I believe we have one more question, and that's from Cliff.
Hi, I'm Cliff. Thanks for the information that you shared today. Since I am a younger male and you're saying that younger people can be diagnosed with colon cancer, what kind of symptoms and signs should I be looking out for? And also, should I contact my primary care physician or who should I reach out to? Thanks.
Thank you, Cliff. I'd like to answer that question if I may. As a primary care physician, I consider it an honor for my patients to contact me if they have any questions or concerns. Dr. Google is not the doctor to contact. It's Dr. Williams. So I do say, Cliff, contact your primary care doctor. And then what happens, that starts the ball rolling so that we will sit together, we will talk about your questions. I will ask questions about your history, the different social things that you do, if there are any risk factors that you have. And so you brought up symptoms, and I'd like to talk about some of those as Dr. Hackworth did earlier. So you talk about things like abdominal pain, change in your bowel habits. Some people have a bowel movement once a week, some people have 2 a day. So if there's a change in your bowel pattern, that might be something that is interesting for me to know and for us to discuss. If you have any blood that you notice when you're having a bowel movement, or if you notice anything different when you wipe. It could be the toilet paper you're using, so don't forget about that, but it could be that there's something going on in an area of your body that we need to look at closer. Any weight loss that maybe you aren't having or wanting to happen, anything in terms of your diet, you may eat differently, you may not be hungry. And so those are symptoms that I would definitely like to know about and decide if we need to go further with screening. Don't be afraid to ask any question to your primary care provider. And if you don't have a primary care provider, please seek one out. We're here for you, and we can help decrease anxiety. So the last thing I would say is if you're feeling anxious about colon cancer, please go to your doctor. At Riverside, we have My Chart. We have various ways to get in touch with us. We have the internet, Facebook. So please feel free to contact your primary care provider if there's any change in symptoms or if you just have questions about colon cancer. I hope that helps you, Cliff. You know, as we talk about this evening, I really wanted to just thank everyone who took the time out to listen, to learn, hopefully, and to get nuggets in which you can use as you continue to prosper and grow. Colon cancer does not have to exist. It is preventable. There are screening methods that exist, and as I said earlier, the best screening test is the one that gets done. I hope you've enjoyed this evening. I know I have. I want to thank all of the panelists who took time to educate all of us. But more importantly, I want to thank you. As you go through March, as you celebrate on this evening, as you think about your future, think about the fact that you have participated in learning more about colon cancer, about helping everybody be healthier in life. We wish you well at Riverside. We're here for you. And again, good evening.